Change Healthcare is a key catalyst of a value-based healthcare system, working alongside our customers and partners to accelerate the journey toward improved lives and healthier communities.
You become a doctor to take care of patients. You become a doctor to serve humanity. Ambient intelligence allows for the patient and doctor to be a patient and a doctor. That like it used to be.
MedEnt helps you focus on what matters most. MedEnt, the all-in-one solution.
Hi, I'm Tony Stadehar, the president of Jackson Physician Search, your executive partner and trusted physician recruitment firm. Come visit our virtual booth to discuss your physician needs, but until then, I hope you enjoy this great event.
We've documented over $8 million in saving. What we're really thrilled about, though, is just the individual member testimonials. Once we get it set up and running, it really takes on a life of its own, sometimes with suppliers, and we make a real difference in the financial viability of their practice.
Did you know that Scrub-In Uniforms is great for groups? With easy-to-set-up custom ordering portals and convenient payment methods, we take the stress out of buying uniforms for your team.
Hey, this is James from Relation, the class category leader for patient outreach in 2020. If you've been doing more with less this year and introducing new workflows to keep patients and staff safe while continuing care, it's time to connect. Stop by the Relation booth and watch our presentations here at the conference.
Eagle count. E-count count. 15 seconds. 3, 2.
Audi e-tron, the next frontier of electric.
Hi, I'm David Cohen, Chief Product and Technology Officer at Greenway Health. Virtual care has risen to the forefront as a key means for providers to treat patients outside of the four walls of their practice. As a key part of Greenway's vision for long-term virtual care success, Greenway Telehealth enables the remote delivery of care to improve patient outcomes. Visit greenwayhealth.com to learn more.
Hello everyone, my name is Jeff Takis and I am the Director of Digital Content at MGMA. Welcome to today's session, Development of a Virtual Care Strategy for Long-Term Success. We have a few reminders before we begin. You can claim ACMPE, ACHE, CME, and CEU credit, and if you view the live session, AAPC, CPE, and CNE credit. Claim continuing education credits starting next week using the MGMA CEU portal. The code for AAPC credit will be emailed to you. Submit your questions, resources, and comments using this chat area. Slides and resources can be found in the lower left section of the previous session page. The education for this session will now begin. In today's session, Andy Gila, Director Product Management UpDocs, and Kathy Kuhn, PharmD, BCACP, FAPHA, Director, Strategy Consulting at UpDocs, will explore how practice leaders can adapt to the new precedent for healthcare. Join us as we take a glimpse into the future and highlight 5 predictions for the immediate future and how these changes will impact revenue growth for your practice. Hear firsthand from our panelists of healthcare leaders as they discuss how they were able to implement technology quickly to deliver patient care and maintain revenue. Andy and Kathy, I know you've got a lot of great information to share. I'll turn it over to you.
Hello, and welcome to today's session, Development of a Virtual Care Strategy for Long-Term Success. My name's Kathy Kuhn, and I'm joined by Andy Gila, Director of Product Management at UpDocs. The pandemic has forever changed the way healthcare is delivered. We know for sure a new precedent for healthcare has now emerged. As we look ahead, we're continuing to transform practice at a rapid pace. During today's session, we're going to look at the 5 predictions for the future of healthcare. And our learning objectives are to review the existing evidence of practice transformation, identify opportunities to transform practice with technology, and discuss how a virtual strategy leads to long-term revenue for practices. So let's start with the first prediction. Telehealth is here to stay. The American Telemedicine Association defines telehealth as a collection or means of methods for enhancing healthcare, public health, and health education delivery and support using telecommunication technologies. Telehealth encompasses a broad variety of technologies and tactics to deliver virtual medical, health, and education services. Telehealth has proven to be valuable by providing numerous benefits, including improving access, cost efficiencies, improving quality, and consumer demand. Improving access to care has been critical during the pandemic to extend the reach and expertise of healthcare providers. Cost efficiencies has allowed telehealth better management of chronic diseases, reduced travel times, and fewer or shorter hospital stays. Improved quality, with studies consistently showing that telehealth provides the same or equal quality of care as an in-person visit. And then consumer demand, by meeting and exceeding customer satisfaction and meeting consumer demand, as telehealth reduces travel time and related stresses, as well as it gives them access to providers that they may not have been able to reach otherwise. So we know the pandemic resulted in providers looking to telehealth as a critical and necessary way to reach their patients. AMA immediate past president Patrice A. Harris, or Dr. Harris, called out the valuable use of telehealth by stating, "The use of telemedicine and remote care services are critical to the safe management of the COVID-19 pandemic, while also ensuring uninterrupted care for 1 million Americans with chronic conditions." Fortunately, during the COVID-19 pandemic, a number of flexibilities were in place to minimize the challenges that providers, practices, and patients previously faced with telehealth. Some of these flexibilities are listed here, such as HIPAA flexibility, telehealth waivers from the Centers of Medicare and Medicaid Services, temporary expansion of telehealth services, cost sharing for patients in federal healthcare programs, and many more. Telehealth adoption skyrocketed. Over the years, we've seen just a small increase, but in 2020, it was huge. Practice adoption changed greatly since 2019 alone. So if we look back in 2019, only 50% of providers or physicians were using or planning on using telehealth, according to an American Medical Association survey. Since then, during the pandemic, 94% of practices said they offered telehealth. But not only were practices adopting, patients were also seeing the benefits. So a number of patient surveys were out there, including one with the Harris poll reporting that 42% of US adults used telehealth since the pandemic first began. And that number was measured several months ago, so we can only guess how much it's grown. But of those patients who use telehealth, 65% of patients like telehealth because it's more convenient than in-office appointments. So now we see that patients' preferences and expectations will continue to evolve in the future. So when we look at telehealth, we've seen successes in certain visit types and populations. So the visit types that practices have found most success with are medication management to titrate, follow up, and check in on medications, chronic disease management, to follow those chronic diseases that Dr. Harris called out that were critical to continue caring for patients via telehealth, and then sick visits. So as patients continue to be sick with minor illnesses or potentially more serious illnesses, telehealth was a great way to check in and do that initial triage. Certain populations also found success with telehealth, and practices implemented telehealth services around these populations. These included generally healthy patients, patients with chronic conditions, children, pregnant women, geriatric patients, and behavioral health. So I'm going to turn it over now to Andy to talk more about how telehealth was implemented around the practices.
Great, thanks, Kathy. And thanks for going into that detail and highlighting some of the various ways that telehealth is being used. One of the things that we wanted to call out, of course, was, the importance of having a strategy and playbook when it comes to implementing telehealth services. So in order for telehealth implementation to be successful, not only for the practice, but also the patients and the physicians and clinical staff that serve them, it's important to understand how to get started in a way that's going to be effective and not burdensome, so that you can have long-term success. So first off, we find it tends to be very important to establish the roles and responsibilities in terms of, as your practice is migrating to telehealth, who is ultimately responsible for the telehealth strategy? Who are the champions in place, and who are those that are going to help facilitate the next steps? For example, when it comes to understanding, what are the legal and licensing ramifications? So for example, if your patient population is spread across a tri-state area or other types of borders, it's important to understand, do the physicians, have the appropriate licensure to treat those patients virtually? Additionally, it's important to understand the various reimbursements, both by Medicare and Medicaid, but also by the various commercial payers that may be at play there. Like Kathy mentioned, we know that what we've seen are some of the great ways to get started are really focusing with some, simple visits like medication management, various follow-ups and check-ins for chronic disease management, and those really common, sick visits, especially those patients and their physicians who have a very good rapport established and, for example, know that this tends to be a typical sinus infection, a common cold and things like that. But in order to do that, you must also understand what is the reimbursement like for the various plans that you're dealing with, and is that a viable strategy to get started? Oftentimes it is, but it's important to take the time up front to understand what those options are so that then you can get started. And again, from that point forward, once you've selected those champions in place, you've created this process and playbook to go ahead and get it implemented and identified, all the legal and reimbursement requirements to get started, it's important to, customize that telehealth appropriateness touch. What that really means is understanding when a telehealth visit is a viable option for specific patients. So at this time, it's really important to understand, what are some of your patients that might live in very rural areas or have difficulty with, access to transportation or mobility issues? It's important to make them aware of what their options are, but doing so in a way that they understand what the trade-offs are between coming in person or not. Additionally, many patient populations are now skewing to using texting and other types of messaging services more and more. So when it comes to communicating about telehealth, being an option, and also engaging them along their care in terms of, reminding them for the appointment, letting them know how to access it. Does your population, one, have the ability, technology, the internet access to make telehealth a virtual thing? And if so, great, how are you going to go about and engage them? Or if not, what are some of those barriers that, need to be overcome? And do you have the capacity to overcome them? For example, if many patients don't have access to internet or smart devices, you may have to reassess how you best get started. Which leads into the next point, which is assessing the technology. Typically, what we find is the more simple the technology is, the more widely adopted it'll be. So while that sounds, like a very straightforward and common thing, it's important to remember that, extra apps to download, username, password requirements, device requirements, the more stringent and overbearing a technology becomes, the more, likely it is that many physicians, clinicians, and patients won't adopt it. So when assessing the technology, it's important that you really go about trying to find, what is that simplest way that you're going to be able to achieve the outcomes without adding, those additional burdens. And so that becomes very important when you design your patient's digital journey. I alluded to this a little bit, which kind of, coincides with customizing the appropriateness approach with telehealth. how are you going to let your patients, discover that telehealth is an option? How are they going to engage with you to understand that for the specific visit they're trying to schedule, they could have a virtual visit? But also more importantly, anything, from capturing, for example, consent to treat, perhaps it's follow-up questions after a visit, or maybe, they need some troubleshooting because their device didn't work. How do you engage this journey and have a playbook in place to understand, what happens along each step? Taking the time to do that up front is going to be really important to make sure that you're ultimately set up for long-term success. And again, there's no one magic approach. Various patient populations, various types of specialties, various types of practices are all going to have a workflow that works best for them and their patients. So it's important to assess and iterate continually, see how your telehealth strategy is performing, and redesign your workflow to make it better if possible. So for example, if you're finding that it's very difficult for people to remember they have a virtual visit, perhaps you can assess ways to better remind them ahead of time and include instructional information to easily let them know when to expect. While that sounds, again, like a very simple thing, what we've typically found is that, that tends to be one of the biggest barriers of people just remembering that they have the visit, and two, just getting reevaluated in terms of what their expectations are, and getting that set is typically pretty important. So these are just some very common ways and very straightforward ways, but very effective to implementing telehealth services. And the reason why this is important, if you lead into the next slide, Kathy, telehealth is here to stay. How long, in what capacity, how reimbursement will look like, those are all things that are actively being evaluated. We don't have the answers here, but what we do know is there's a lot of legislation going on both at the federal level and at various state levels to ensure that telehealth remains, a very viable option for patient care, not only throughout the rest of the pandemic, but eventually too in a post-COVID, world where telehealth will become a pretty important patient expectation and a very consumeristic, shift in how telehealth gets driven. So again, all the legislation and the trends are showing us it will be here to stay, like Kathy alluded to earlier. So it's important to get started, to understand what is the way you're going to start to introduce it to your practice, leverage that practice transformation, and what type of visits and patient demographics you want to target. But all that being said, if you go to the next slide, Kathy, it's important to remember that telehealth is just one part of the whole puzzle. It's important to understand how it's going to work for your entire organization, in the broader picture of things. So, that hybrid care model, how are you not only going to solve, providing virtual visits to your patient, but engaging them virtually now, because their expectations, the patient's expectations are going to shift, once they have virtual visits, to want to be engaged in other ways virtually. Perhaps when they come in, they're going to want to have as much of a contactless experience as possible. So how do you change that patient experience to, meet their expectations, satisfy them, but also provide that contactless experience when they come in and are waiting for the physician to see them? So again, really important to get started and think ahead, at the time of, initiation with these services, how to go about it. But, everyone's learning. There are many resources out there. So, hopefully this was a little bit informative in terms of telehealth being here to stay and how to go ahead and get started. So I'll go ahead and pass it back over to Kathy for her second prediction.
Thanks, Andy. So moving on to prediction number 2, patients will avoid care. So we know for a long time that no-shows and just patients not showing up for visits and signing up for visits have been an ongoing challenge of healthcare. Patients miss appointments for a number of reasons, and those reasons are shared here on this slide. So according to the Journal of Family Medicine and Disease Prevention, the top reasons for missed appointments include forgot or did not know about a visit or no reminder call, a personal work unrelated issue, problem with transportation, too sick to come, and problem with insurance, just calling out the top reasons for missed appointments. But not only are these missed appointments, people are also just not even making appointments. So we can predict that patients will continue to avoid care until we act on how to bring them back in. So during the COVID-19 pandemic, like I said, we had already experienced patients avoiding care way before the pandemic. But now during the pandemic, we've seen some pretty crazy results. So 70% of clinicians experienced a greater than 50% decrease in patient volume during the pandemic. And then 12% of clinicians say routine check-ins, particularly with cancer survivors, have fallen. And a majority report that follow-ups for common conditions such as lung disease, hypertension, is happening very little or not at all. And lastly, 60% of clinicians believe that some of their patients will experience avoidable illnesses both due to diverted or avoided care. So this is incredibly troublesome. And so we must do certain things in our practices to make sure that patients don't avoid care. So I'm going to turn it back over to Andy so he can talk about how we can improve this.
Great, thanks, Kathy. And, this really fits in well with the previous prediction as well. And a common theme, we're seeing that I don't think any of us are surprised by, but we think this pandemic has really accelerated is, patients' expectation of a more consumeristic experience and just better convenience. So, when it comes to patients, avoiding care, whether it's for any reasons between, lack of convenience, perhaps they forgot about an appointment, or they just want better access to care in new ways like virtual care and telehealth, it's important to really assess some of the underlying factors in, improving visit rates. So one of the first things to get started on is assessing the no-show problem. So when you look at the various no-shows among your patient population, what are the key drivers? Reaching out to patients and understanding why didn't they come to the visit. If it's something, as simple as they didn't remember they had the visit, looking at an appointment reminders, a solution or ways to better, remind them could be a very effective and simple way to get those patients into the office or onto those telehealth visits to remember it. Perhaps some of the reasons they might be no-showing is because they didn't have access to transportation, or they're out there in a rural area and they just didn't want to make the commute because it might not have been convenient for them. That, or potentially, they did not want to take a day off at work, or just didn't want to, take the time off because they can't afford to financially. Those are some other ways that you can leverage, telehealth potentially to meet them where they're at and provide them that more consumer-facing experience while also giving them the convenience that they're looking for. So again, those are just some of the ways that you can assess the no-show problem, which really goes into the next point about prioritizing patient accessibility. Now, more than ever before, patient access is, really a key driver to a lot of these problems, and patients' expectations are really going to shift. For example, as many of you know, they now not only have access to their traditional, physicians through their practice, but they can go online, they can get access to, an on-demand telehealth solution. There's other types of virtual care. So ensuring that access is being met by your practice is going to be really key in not only retaining, key patients, but also acquiring new ones. So making sure that patient access is being treated for, whether it's, providing ways via texting or other solutions to better engage them and understand when they can't make a visit or need to reschedule, or, offering telehealth to provide more convenience to them so they could still have the visit, are some very, critical ways to improving those visit rates. And again, some of the basics too, right? Educating patients on the importance of their visits. Patients continually are going to need to be reminded, as always, that it's a lot easier to manage chronic diseases or even prevent long-term, issues in secondary or tertiary care by getting that primary care, by coming in for the visits, and understanding how, prevention today really has a compounding effect in the future. So continual education of that is really key, which is important to increase the internal awareness and attention to your staff, making sure that they understand, what the patient no-show problem really is and why it's being driven, understanding how they can help provide patient accessibility, and just really helping them become champions of that patient care and giving them the tools and information to continually educate patients, both during the pre and post visit cycle and even during the visit itself, on the importance of care and the various ability they may have to get more convenient care that some patients may not even be aware of, for example. So again, it's important to adopt these specialized and flexible approaches because a little bit can certainly go a long way. And as you think about the compounding effect of introducing these, even by little to your practice, it can really make a difference over the course of 3 months, 6 months, a year, let alone for your practice transformation, but especially for patient care in the long run. So with that being said, I'll go ahead and pass it back over to Kathy for the next prediction.
Thanks, Andy. So the third prediction is waiting rooms will disappear. These images probably look all familiar to you. We can all certainly agree that in the past, I guess 6 to 7 months now, since the pandemic began, our waiting rooms definitely look different with different signs, procedures, check-in processes, and means of social distancing. But the experience that patients had with waiting rooms was never a pleasant one. And so eliminating waiting rooms was something that practices have already begun to do. The Dell Medical School at the University of Texas at Austin actually had already pursued eliminating waiting rooms way before the pandemic occurred. So their quote says, "The possibility of eliminating waiting rooms represented one opportunity to transform the patient experience. For patients and family, the feeling of wasted time alongside others who were ill was a source of frustration and anxiety and reinforced the prioritization of the system's needs over the patient's." So certainly the pandemic has changed things, and we've already begun changing our waiting rooms. But why do we even have a waiting room is a great question. So another study showed from the 2019 Qualtrics Industry Pain Index, they had a study which reported that unpleasant waiting rooms were the single most cited reason that patients said they would stop returning to a healthcare facility, whether it be a PCP, office, emergency room, or urgent care. And because of their poor experience in waiting rooms, patients often cited that their confidence in care from the providers really had diminished, or their overall perception of quality of care that they received was negative. And so transforming the waiting room experience and eliminating it altogether is an opportunity for us to improve the patient care experience in the future. So here's just a sample of how practices are beginning to eliminate waiting rooms. So we're often seeing practices send a message or a link or a text to check in to their visit. And oftentimes the patient is doing so in their car or outside of the office, not in a waiting room. So when the patient does arrive, they are remaining in that car, clicking on that link, and then checking in with by completing any type of paperwork or what we're most commonly seeing is COVID-19 screening questions. This opens up not only personnel to work on other important tasks within the office, but then also improving the patient care experience so that they are safely distant from that miserable waiting room experience that they've been known to have in the past. And then the practice is able to virtually review the completed check-in information and then let the patient know via text to come in for their visit. So again, the patient is no longer experiencing that poor experience in a waiting room, but instead is notified via text in a way that they prefer to be on their mobile phone and are able to safely enter directly into a practice or a patient room. So I'm going to so I'm going to call out now the fourth prediction, which is virtual collaboration will improve care fragmentation. So we talked about with waiting rooms disappearing, the patients and providers are collaborating, as well as telehealth and patients avoiding care. So virtual collaboration is really calling out the need to improve provider to provider collaboration to improve that care fragmentation that unfortunately we know occurs in the healthcare industry. The unintended consequences of care fragmentation is that it leads to higher costs and lower quality of care that's delivered. So unfortunately, inefficiency, ineffectiveness, inequality, commoditization, commercialization, deprofessionalization, deprofessionalism, depersonalization, despair, and discord are all these negative consequences that we're seeing in care delivery. So what we must do instead is view healthcare as a whole, rely on personalization and relationship building, and professional and shared responsibility. And those are things that we need to count on when we're collaborating provider to provider. So healthcare practices are doing this in different ways now, especially with the emergence of new technologies. So I'm going to turn it over to Andy so he can talk about the clinician-clinician communication experience.
Great, thanks, Kathy. And like Kathy said, one of the keys moving forward is going to be to enhance and provide better virtual care collaboration, especially in near real time as possible, for clinicians to truly be able to drive the kind of care that we all want forward. So a common model that we're starting to see emerge and develop is the concept of an e-consult. You may have also heard it as a curbside consult, but really what it's intended to do is provide a clinician-to-clinician communication model in, as near real time as possible, but definitely within 1 or 2 business days to really determine the necessity of a referral. So many of the organizations we speak to oftentimes feel that up to 50 to 70, sometimes as high as 80% of their current referrals are unnecessary, and oftentimes that means it's wasteful medical care. Either the patient doesn't need it, or they could have been directed somewhere that would have been more appropriate. So in order to help drive down on those unnecessary referrals, it's important to provide ways for these clinicians to engage with their peers and determine if or not a referral is necessary for a specific patient. So there are some interesting ways to get started with this. Oftentimes, especially if you're in a large or multi-location, multidisciplinary practice, starting internal can oftentimes be the best way to go about it if you don't have such a program in place. So providing technology such as HIPAA-compliant texting or even HIPAA-compliant video consultations can make it possible for those that are referring providers to reach out to their peers and have a process in place to determine whether or not a referral is necessary. So for example, what that means is a patient would come in, they would see a referring provider who would be unsure whether or not a referral is truly warranted for the patient. This organization would typically then have some rules of engagement with the specialties that they're not necessarily contracting with, but working through with this. So again, the best way to get started if you're someone large and have multidisciplinaries internally, but it's also important that, if you don't have that, look into your region, see what types of specialty groups can you start such a program with, and really agree to those rules of engagement. So one, how are you going to communicate out there? So for example, if you're using some tooling like, HIPAA-compliant texting or video, letting them know how they'll receive a request for this type of visit and how they can engage back and forth in a HIPAA-compliant manner. Perhaps you're going to be using, HIPAA-compliant digital forms to submit something to them that they can manage. But whatever the technology is, it's important that you establish that relationship and also get those rules of engagement. So then ideally, you have a flow which a clinician who is unsure about whether or not a patient has a need for a referral can reach out to their specialist peers who can, work through the list, understand whether or not, there's additional information needed to determine and have that, consultation, or even right away understand that, no, this is not something that needs a referral, or no, this is absolutely something that needs a referral, to really drive forward that care. And, by being able to provide this kind of model and provide this type of, virtual collaboration, it's really going to lead to greatly reduced numbers when it comes to referrals, thereby, making it so that those getting referred truly need the care, and those that aren't, have fewer frustrations in terms of going and having unnecessary visits. So while it's one pretty straightforward and simple way in concept, it takes a lot of hard work to set those relationships in place, establish those rules of engagement, and find out the tactics to support that. But like Kathy said, we really believe that this will be one of the key ways that the future of healthcare can evolve, by providing this clinician-to-clinician communication. So on that note, we're going to go ahead here, and if you go to the next slide, Kathy, transition into the next prediction, the final prediction, if you will, at least for this presentation, which is that practices will be paperless. So there's a few different ways to tackle this. And as we go on to, the next slide here, one of the first ways to go about it is looking at the facts reality of healthcare. As many of us know, healthcare is one of the few industries that still heavily relies on faxing. And part of that is because everyone has a fax number. It's a HIPAA compliant way to communicate. But oftentimes what that results in is a lot of paperwork, a lot of information that has to be viewed, determine if it needs to be annotated, scanned back in. So by providing a fax-free world by 2020, you could see what Seema Verna, the CMS administrator, launched the Patients Over Paperwork initiative to help patients by allowing doctors and non-physician practitioners to focus on care instead of paperwork. She called for a transformation in patient care by improving communication and data exchange and challenged the healthcare industry to be a fax-free zone by 2020. However, more than 9 billion faxes are still sent every year in healthcare, and fax still accounts for about 75% of all medical communication. These numbers don't even account for the paperwork completed by patients, collected by practices, and just the negative impact that this has to a patient experience. So if you think about all the paperwork that's flowing in your organization today, some of the ways to kind of move forward and provide a more seamless experience, both for your staff and also for your patients, is to start digitizing as much of that as possible. Doing so can result in, cost savings, both in terms of saving paper, reduce use on the fax machine, but most importantly, it should provide better visibility through digital solutions, additional time savings, and just more efficiencies in general. So that's just one of the ways to move towards being a, paperless practice. And if we go on to the next slide, I'll talk a little bit about, how digital forms can play a purpose, and then I'll hand it over to Kathy to talk about how certain assessments as well can really provide better patient experience while also giving much needed clinical input. So you heard Kathy allude a little bit earlier about, a check-in process that could be better, eliminating the waiting room. Well, one of the ways to do that now, for example, as many of us know, if you're going to the physician today, oftentimes you're having to wait in the waiting room. You're going to have to fill out the paperwork they give you, give it back to them. Sometimes it feels like we're filling out the same form over and over again. And especially now with the pandemic, many patients might also feel additionally uncomfortable with just being in the waiting room and feeling, more exposed because of the various, pandemic that's going on and just other sick patients that may be coming in and out. So again, by offering a digital form solution, not only can we eliminate that waiting room experience, perhaps have patients fill out a form in their phone on the car, text back and forth to say they're there instead of waiting in the waiting room. But it also leads into an opportunity of ways to capture patient-reported outcomes and other types of clinical assessments, which I'll pass over to Kathy to speak about.
Thanks, Andy. So I wanted to share with the group these example screenings and assessments that you can turn into digital or electronic forms to improve that patient experience. So this table was adapted from the American Academy of Family Physicians. And what you'll see is that there are a number of examples of, again, screening and assessments right now that are available that are best practices patients or providers should be using to enhance their patient care and collect the information that they need to appropriately assess a patient. So when you look at these codes and these forms, this is not only a way to transform the patient experience by switching them to electronic forms, this is also a way to capture clinical information to, again, better assess and treat your patients. So if people aren't capturing these opportunities right now, this is potentially revenue that you're leaving at the door for your practice. So as we talk about practices being paperless, so just to wrap up, electronic forms and electronic faxing, so thinking about the in-office experience from the staff perspectives, the faxing really is painful for the healthcare industry as a whole. And then electronic forms really ties into the poor patient experience that patients often have in the waiting rooms, and really the need that physicians and other providers need as a way to collect patient information in a timely and accurate way. So I'm going to actually wrap it up or turn it back over to Andy as he wraps up and talks about how these 5 predictions of the future of healthcare go into the virtual care strategy.
Great. Thanks, Kathy. So again, just to recap for you guys, I know we talked about, telehealth being here to stay and just some of the ways to get started by providing virtual visits and really, meeting patients where they are. We talked about how patients, the general avoidance of care and how it can come down to a variety of issues from just forgetting they have an appointment to lack of convenience or, lack of ways to access care in the ways that they want to access it. We talked about just the patient experience in general and how waiting rooms are becoming more and more of a negative experience as patients get exposed to that more, real-time and on-demand care and ways to tackle that. Of course, virtual collaboration and how there are some simple ways to, leverage provider to provider communications to, better both impact patient outcomes, but also just a practice in general. And then, going paperless and just some of the crazy statistics when it comes to how many faxes are used. What's obviously apparent, as many of you are living this day to day, practice transformation isn't an easy thing. There's a lot of ways to get started. There's a lot of problems that you can tackle with a lot of intended outcomes. So in order to make that effort the most effective, you need to be able to figure out who the champions are that are going to lead that forward, organizing, for lack of a better term, a playbook or a checklist to get started with a focus on intended outcomes. And what you need are solutions that work for you and with you and not those that work against you. And what I mean by that is, the technology is just part of the equation. Really, what many of you and, all of us as patients want are practices that provide optimal care in the most, happy way for customers to really experience it as patients. So as a result of that, the more barriers you place for your staff and for your patients in terms of the more solutions they have to log into, the more types of systems they have to interact with, the more difficult it'll be to achieve that kind of experience that we talked about here in terms of where the industry is going. So it's important to understand that, one, pick one thing to start with and grow from there. You also don't want to overwhelm yourself with trying to tackle too many things at once. But ideally, you can kind of create the snowballing effect where you start to solve one problem and kind of build on top of that. And that's going to be especially more effective if you're working with a solution that can offer, ways to help with all of it versus having to retrain and start from scratch when it comes to solving other problems. So as a result, it's really key to get solutions that work together. And if you go to the next slide, Kathy, it's, lack of integration between systems lacks as healthcare number one frustration when it comes to technology. So that was a recent UpDocs healthcare technology report that we did. And, it was really apparent just how frustrated everyone was with the lack of integration. Because again, it just really takes away from what everyone's trying to do on that day-to-day, which is really achieve, great patient outcomes, provide a great experience for those patients, and technology should be working with us, not working against us. So that's why it's really important to address some of these issues there. So if we go on to, recap everything that we just did, hopefully this was helpful in terms of what are some of the trends we're seeing, what are some of the ways to be part of these trends, address these trends, and some of the obstacles to overcome and how to do so. We can go up here and wrap up at the last slide. Obviously, you guys feel free to go to updocs.com or message us at info@updocs.com to ask us, additional questions or learn more about the company. But we really want to thank MGMA for this opportunity. We want to thank all of you, the attendees, and just everyone that's, really been working their tail off this year, especially to providing access to care for patients, treating patients, supporting those on the front lines. We truly appreciate, the time and opportunity to be here. So we just wanted to say thank you again.
Well, thank you, Andy and Kathy. That's it's very interesting. It'll be fun to test those predictions over the next however long, 3 months, 6 months, 12 months. Some great chat in some great questions in the chat. It's the dominant aspect of chat focused on patients who just don't get the technology or don't have access to the technology, phones, etc. I saw some responses there. I guess my question is is there room in a practice for those who get the technology and those who don't? How do you suggest organizing that?
Sure. I can take a first stab at it and then let Kathy finish through. But
Sure.
yeah, the thing we want to iterate is it's definitely not a one size fits all approach. I mean, it's going to take some time for everyone to adapt. We think the pandemic and some of the innovations definitely accelerated healthcare forward and really brought to light some of those things that patients have been wanting for a long time when it comes to a more consumeristic experience. But there's definitely going to be, a lot of those patients who either, lack access to the technology, lack access to transportation. So it's going to be very important for organizations to think of that hybrid approach and understanding, in one hand, pushing forward, trying to give a more consumer experience, but also not leaving those patients that just don't have the opportunities behind. So balance will definitely be key. Kathy?
Yeah, I mean, same thing Andy said is that preparing for just not the one size fits all, but I think a practice can quickly identify what are the themes that are occurring, whether there's a big group of patients, like several people had said, that don't have a cell phone, how can we accommodate that group or that population? But then also there is going to be still a good amount of patients who do have a cell phone and who are still looking to utilize their technology. So again, being able to prepare for both, and really you guys know your practice is the best. And so it's best for you to sit down with your team and evaluate what are the options you should present.
Great. How about training patients on the system? What have you tried? And I'd love to hear from attendees too in the chat. What have you tried to train the patients? Has it worked?
Sure. So training the patients really is, honestly a staff responsibility. So we don't need to talk. Staff obviously has plenty of responsibilities, but patients are definitely number one. So first and foremost, I think communicating and training your staff through not only like a learning session, but daily huddles and reinforcement has been a key. So transparency around issues and that have come up along the way, and just being able to quickly pivot to continue to improve along the way has been important.
Great. It looks like Jennifer, I think it is, has a bit of a prediction of her own. With the question, are there plans to create a central repository that gives ownership of medical information to the patients? Is that partly where this is going?
Yeah, that's a great question. I think it's an ideal state for healthcare. I know there's a lot of barriers on the way there, just in terms of data rights and ownerships. How do you monetize models like that to ensure that the patient has true access? But I definitely think we'll start getting to places where patients will have the ability to access their data more on demand than ever before and be able to share it. I know Apple, for example, is trying to get into that space a little bit with just collecting some information. But I definitely think that's the ideal end state, and we're a ways away, but tons of improvement to be made in the meantime.
Right. You spoke about the need for an integrated solution where you've got SMS and all. You had that wheel graphic towards the end of your presentation. I think it makes a lot of us hesitant. Makes us think we're going to hit the rocks. Our boat is going to hit the rocks as we try to come to shore with these kinds of things. Where do you see most practices getting in trouble as they try to implement this? Is it lack of full integration? Is it a lack of connection to the EMR?
Yeah, I think it's a little bit of you want to take one step at a time and not bite off more than you can chew. And a little bit to Trisha's question in the chat, you also want to take that step, right? So I think for most practices, we'll either see it can be a little overwhelming to know where to start, so they don't start, or those that do might try to bite off too many different things at once, because again, we have to be realistic. It's, we're asking for a behavior change of a lot of people, a large shift. So what we found tends to work best is really just focus on one workflow to start with that you want to change, whether it's how you're doing appointment reminders, maybe it's just how you're sharing certain information out to patients. And we tend to find that it really snowballs after that, because it's a nice kind of entryway into new behavior, into new approaches. And then you can slowly layer on more ways over time. So that wheel, to your point, it is a great, it's a great ideal state, but you don't have to get there from day one. It really work your way up there over time.
That's good to know. So if you're missing a couple of spots on that wheel, it still rolls.
Yeah, I think just to add on, I think it's important to think ahead of what your future strategy is. So this is all about the virtual strategy, right? So quickly, everyone adopted telehealth as their virtual strategy, and that for sure was a Band-Aid because it was necessary in the time of COVID. But we also need to think ahead. So I think that the planned approach of thinking about solutions that offer multiple things so that you don't have to end up going back and piecemealing together your solutions and your strategy. So again, we adopted telehealth, but telehealth is only one part of that virtual strategy, and sitting down and thinking about not adopting everything right away, but what's your planned approach and how are you going to help your team with change management.
That makes sense. Well, this has been really interesting. We have very little time left, about 40 seconds left. Anything in closing that you would like to say?
Yeah, for me, again, I just want to say thank you to everyone again, and then also just reiterate, it's a phased approach, one step at a time, and being pragmatic about it can really take you a long way.
Great. Thank you. And attendees, we apologize. There was some variability in the quality of the slides. Some saw it fine, some didn't. You can access it on the session page. Go to your session page, scroll all the way to the bottom, and you should be able to download those slides. Apologize for the variability in performance there. Thank you, Andy and Kathy, so much. Remember to visit the exhibit hall and look for other great solutions. There's quite a bit on virtual and telehealth attendees. Thanks so much, and everybody have a great rest of the show.